in front of my camera. I'm just removing the cover. Fine now. Yes, yes, yes.
Okay. Yeah. A warm good evening to everybody. And I think this is a great time to interact with you all. And I hope most of you listening to this video must have got very good ranks in your NEET, and with all the hard work and dedication that you have done throughout this preparation journey, this must be a great relief to be able to select some very, high sorted branches, I would say, and really wish more success and happiness and a bright future going ahead. And we have with us Pallavi ma'am, who will be talking about the dermatology options, and I'll be discussing about the radiology branch as such. Yeah, ma'am. Good evening, ma'am.
Thank you, sir. Good evening. Good evening, all of you. Congratulations for coming to the stage where you watch this video, because you are watching it as you've got a good rank in your NEET PG. And now the next step for you is to choose the branch, because that is going to shape your life and your career, which you have envisioned since your childhood, what you are finally going to become. So I hope you are at that stage where you choose between radiology and dermatology.
Yeah.
Congratulations.
And I want all of you listening to us to put in your queries. We are listening to you in the chat box. We'll be taking up all your queries throughout the discussion. And we'll also, tell you all the respective things that you need to know with the branch as we go through. So please feel free to interact and put in your queries in the chat box also. Let me just begin by, ma'am, what do you think? How should we go about choosing a branch just because they got top ranks? Do you think they should choose either radiology or dermatology, or there should be some mindset to have a selection of a branch done?
Sir, mindset is very important because, you have to be following this subject for your life. You have to be doing justice to it. So you have to be sure of your ability to pursue it before you pick it up. But when it comes to dermatology and radiology, these are both those subjects to which you don't have much exposure in MBBS. So for us to say that you have an inherent liking for dermatology or an inherent inclination towards radiology would be a little tough when you are in MBBS. So these are choices that you make after looking at these two subjects, introspecting what kind of subject you want to pursue, which is also decided by your inclination, your ability to be the type of clinician that you want. You want a very heavy-footed, a life-saving emergency, that thrilling branch, or you want a little light clinical work, or you want a non-clinical but clinical, that is radiology. So what kind of a subject you wish to pursue comes from the introspection, your choice. That should not be dictated by anybody. You just have to close your eyes and think whether you see yourself as these two branches. And once you are there to choose between these two, you have to also see what are the options available at your rank, where, in which kind of colleges they are available, and make an informed decision about your choice. I feel this is more of an informed decision, I would say, when it comes to choosing derma and radio, because you don't have an inherent inclination to take these, is what I feel. So what do you say?
True, ma'am. True, ma'am. I mean, I personally feel there should be no bias towards any branch. In the hospital, every branch, every specialty has its own unique role. It is irreplaceable, and everybody has done super good in their respective branches. You will see amazing surgeons, amazing physicians. You will see a lot of very well established obstetricians. So do not have a bias and select your branch. Okay, so and do not look at the 3 year of hardship that you're going to go through during your residency before picking up your branch. This is going to stay for your life, so choose it wisely based on your interest. First thing I would want you to understand is whether you are having the physician's mindset or you're having surgeon's hands. So this is something that during your internship period. This is something that during your postings. So if you are a thinker, if you are having that physician's mindset, these branches would be more favorable for you. And if you feel happy doing procedures, doing sutures, maybe small things that you have done in your internships, and you felt very satisfying in that, and you feel that you have that surgeon's hands, or the feel-good factor after doing a procedure, I think you should also pursue your surgical branches with equal inclination towards it. So do not decide a branch based on, the rank that you have got, or based on what people are saying. It is personally you. Every branch is unique. Every branch is special. You can be the best of that branch and make a wonderful career for yourself. And ma'am, a few things to begin with. Many students at this point of time, when they are trying to decide between these subjects, I think they would look at what are the pros and cons of each branch. In regards to dermatology, what do you suggest, ma'am? What are the pros and and the cons? You've been a very practicing and a very busy dermatologist. We would, get good insights from you regarding this.
See, sir, when sir said a very right thing, that do not see the 3 years of your residency as the criteria to choose a branch, whether it is light, whether it is heavy, that is not a criteria. Because when we talk about pros of dermatology, what you see is that it's a 9 to 4 branch in most of the medical colleges. So you see a very relaxed atmosphere. That is something you also get after the post graduation. So that's a criteria I'll put first, because it gives you want to be a doctor, you want to face patients, you want to deal with the patients and do your clinical work, yet you want a relaxed life, you want fixed hours, you don't want any night duties, no emergencies, no patients calling you at the night, you can switch off your phone when you want. So that is a very important factor when we talk about dermatology, that it gives you fixed working hours without any night duties. Yes, during your post-graduation, you do have night shifts in your hospital, but that generally ends with the 3 years of PG. It does not go beyond that. So that I feel is a very important factor when you are making this decision. Secondly, coming to the subject I'm putting second, because generally it is not the subject here which is making you choose. So subject, I'm making it second. As a subject, it's a beautiful subject. It's a visual branch. You make a diagnosis as you see the patient. You hardly need any blood test. You hardly need any investigation. So it's a real challenge to make a diagnosis as the patient comes. It gives you a lot of thrill. It gives you a lot of satisfaction when you do that. So that is an advantage. Plus, you have patients of all sizes, all genders. Your branch is irrespective of the age of the patient. Plus, you also get patients with a lot of internal morbidities. So, it's a good exposure. It's a diverse patient profile. Secondly, the patients are, not very challenging, in a way that the stress level is less. It's not life-threatening. Most of the dermatology cases are not life-threatening. You don't see a lot of mortality here in dermatology. So overall, your stress of treating a patient, your stress of dealing with violence or relatives, that is on the lower side when it comes to dermatology. It's a very branch which is a mix of, as sir said, you have to identify where you belong, whether you belong to a medical specialty or a surgical hand. You get a mix of both when it comes to dermatology. You can see your patients as a physician, do medical consultations. On the other hand, you have a lot of dermatosurgery procedures. We have a lot of lasers, a lot of different types of machines. There's hair transplant also. Nowadays, even cryo liposuctions and other blepharoplasties and rhinoplasties are also being done by dermatologists. So there is a mix of medical and surgical consultation that you get here. So during your PG, this is the, a good advantage, that you get a good exposure. Plus, most of the dermatology departments are small. Hardly 2 or 3 residents go every year. So these are smaller departments in the medical colleges. Since it's a relaxed environment, they all stay happy. They all keep laughing, so you are relaxed. You have a lot of parties. The faculty is very close-knit group, so you can talk to them, you can discuss, you can study from them. Overall, it's a very happy atmosphere in your residency. That is actually a very moral boosting thing, I would say. It raises your confidence in your branch. It raises your confidence in your ability to practice as a dermatologist all your life, because your learning happens very nicely in your colleges. As you move out of PG, you can set up your clinic wherever you want. There's a demand for a dermatologist in every corner of the city, in every corner of the country. So you can set up a clinic nicely. Your patients keep building up. It's a medical branch. It's an OPD heavy branch. So you get good volumes of patients. You have good volumes of procedures. You have fixed working hours. As a dermatologist, I have fixed hours. I will not sit beyond that time. I will not take phones beyond that time. You don't see it as important when you're making that choice at 24, 25 years of age. But as you get older in your life, you get busy in your life, this is a very big advantage that I feel dermatology gives, that you are your own boss in the time you are out of the hospital, because most of the patients do not have life threatening issues. It is okay if your phone is off. It's an elective branch. So that's a very important pro. You don't have any admissions under you in hospitals. You don't have to go for Sunday rounds. You don't have to go for holiday rounds. So all this looks very thrilling in your PG, but that's an advantage for the later life. You have flexible hours. You can take vacations. You can, shift your OPD. You can block your days. Elective patients take appointments when they want. So it's all relatively happy, as I would tell you. If you take an institutional job, again, it is the same for all branches. It is as cool for dermatology also. So these were pros. Cons are many. As you enter the PG, you don't know the subject at all. They make you look at skin lesions and you wonder, what is a macule, what's a papule? You can't make out anything from skin in the first 6 months of your PG. So that's a little disappointing to a lot of students, because you come with such high expectations that, oh, you will conquer everything, and when you come to a branch you don't understand anything. So that's a little letdown for a lot of students, but it generally grows on you. Then you don't feel the thrill and the high octane rush of saving lives, when you are seeing your medicine and surgery colleagues and OBGY colleagues running around with stats around their neck, saving a patient's life, giving them CPR. You miss all that in derma. You don't get that. So if you're very heavy footed, you like all this, then in dermatology, it's a relatively laid back branch. You may not like it so much. So these are, and very academically intensive. We have big books. You have to study a lot in derma, and those diseases which you cannot even pronounce. So it is a little challenging for people who don't like to read a lot. Once you come out of PG, senior residency jobs are few. Government jobs are even fewer. So that's a loss. Fellowship opportunities are fewer. You hardly get 1 month, 2 month fellowships that don't teach you as much. So if you want to crave for more learning, you have to do it as you work in your clinics. So that kind of options are not there. If you're looking for jobs in private setup, there are no jobs in multinational corporate hospitals, which is something you don't know as an MBBS when you are making the selection. There are no fixed pay jobs. There are no full-time working jobs. It's an OPD share basis that they will employ you. So you see your colleagues getting fixed pay, good jobs full time. You don't get that in dermatology. The only options are a few aesthetic clinics or a few senior dermatologists who may employ you. But if you want to move cities, you want to have a transferable job where you can move with your spouse or you can move somewhere, that option is not there in dermatology. Plus, setting a clinic is easy. You need 2 rooms to begin with, but as your practice expands, you need more space to make more procedure rooms available. So you need to have that entrepreneur ability. You have to set up a business. You have to think like a business person when you are in dermatology. That is, again, something not everyone has, okay? So think of yourself as an entrepreneur. You are not going to be working for someone. You are not employed. You have to run your own setup. So have that business mind, have money to invest to set up a place as soon as you come out of PG. That is also important. Have those things in mind. Pick up heavy machines, expensive machines. So these are all the cons as well. Pros everybody knows. The cons, not so much, because cons are not discussed as much. So these are the cons that I want to tell you. But one good thing is it's an end branch. You don't have to study for any DM or MCH exam. You don't have to give another entrance exam. You are all good to practice as and when you come out. I think that's a very important con when it comes to derma. Sir, about any other thing you would want to add?
Yeah, I think a lot of students have joined in. Dheeraj, Dhananjay, Saikir, and Karthik, Rajesh, right? And you can Babu, Surya, you can all put in your comments. We'll be looking into and taking up your queries through also. And about pros and cons of radiology. So the first thing that I took radiology was for the work-life balance. And the immediate benefit that you're going to get is a cooler residency as soon as you join. Compared to your clinical branches, you will have a much cooler residency life. And it gives you a good professional time and a personal time to look into your hobbies, look into your passions and stuff. So that is one thing that you should expect from both radiology and dermatology. The important reason people pick this up is a good work life balance. And the other thing is, this is academically very, very satisfying, especially radiology. When you have the clinical radiological correlations done, right, you have a lot of your clinicians coming up with various differentials. The diagnosis is made in the radiology room, like looking at the images, looking at so that academic satisfaction, and you will become the center stage, right, with for all of these specialties to come to a diagnosis. So that is really, really academically very satisfying journey that you will have. And other thing, the work wise also. So after your residency, when you're into your work also, it has freedom of you can select your timings. You have freedom to work per hour basis. You have freedom to work in your hospital for a fixed time slot and then go to a different setup for a fixed time slot, or you can also venture into having your own setup. So it gives you a lot of variety to look into and options to look into. So I think being a center stage, a converging branch for diagnosis, and also for the less patient interactions also. So sometimes you don't have too much of emergencies in radiology also, right? So you have less emergencies to look into. So these are some important pros. Really, radiology will make your life much happier and peaceful also. And coming to the cons, I would say, yes, you will not have the patient attention that you were seeking or craving for, or the kind of satisfaction that you would be looking for. So that would be on the lesser side. Your primary doctor would be the surgeon or the physician who will refer your patient to you. So do not expect such kind of huge attention from the patient in the radiology. Other thing in radiology, the cons in radiology, if I would say, is these are lots of academically intense branches. With radiology, you have to study all the systems, right from the head to toe, right? Every system. You study a lot of neuro, you study a lot of chest radiology, you study musculoskeletal. So there's a lot of reading to do, a lot of books, and as ma'am said, big books to study. So it is an academically dense branch, and with less patient interaction. If you are craving for patient attention and craving for that kind of drive, right, you would not find this in this. These are the cons that you would have. Ma'am, going forward, what are the scopes and future in dermatology, ma'am? I mean, how is these branch scaling up?
So there is immense scope for dermatology. I can surely tell all of you. Yes, you would hear that the metros are saturated, but that is so for all clinical branches. There is always space for a doctor. Doctors can never be too many anywhere. So there is nothing like saturation. It has a very good scope. The best advantage is that you don't have to depend upon a hospital. You don't have to depend upon anybody. You can set up your own clinic, be your own boss, work according to your times. And I would say a little bit of disadvantage in the tier 2 and the tier 3 cities in terms of scope is that you're competing with a lot of Ayurvedic, homeopathic, RMP doctors and MBBS doctors, because all of them tend to be a dermatologist. Patients tend to take treatment from them and the chemist before they come to you. So you are actually a referral center for a lot of patients, if I would say. That's a little disadvantage. As my HOD in UCMS hospital used to say, there are 100 crore dermatologists in this country. Everybody will treat their skin before they actually turn to a doctor. So that's a little disadvantage that you face when you are in tier 2, tier 3 cities. But a good doctor will always, shine above anyone else. Patients do come to you after having not getting benefit. So that's a very good scope. High volume clinics, I would say. Dermatology setups are just like you see a medicine physician running their high volume center. Most of the dermatology centers are high volume. You can have an OT and do surgical procedures, yet you don't need to admit a patient, yet you don't need to bother about pre-op, post-op. So you are a surgeon, you are doing your procedures, you can keep the fanciest of the machines, do the best of the procedures, which are indicated, which are off-label, there are so many experiments and there are so many, nice modifications and your own treatment protocols that you can make, that you actually feel very good at the end of the day, giving the patients the results that they want. So a lot of scope for dermatology. A very important upcoming sector is aesthetic dermatology, where you do anti-aging procedures, you do hair transplant, you do lasers for a lot of indications. With younger population coming up with more awareness, with more pictures required for social media, I would say there is a lot of demand for the younger crowd to get themselves treated. The older generation would still go to a local practitioner for dermatology consultations. The younger crowd does not. So your patients will keep increasing, seeking more of surgical procedures, seeking more of cosmetic procedures. So I would say it has a very bright future, but only thing is you have to have a business mind. You have to know how to set up a clinic. That also you learn, with hit and trial, you pick that up. So you don't have to worry about future. You don't have to worry about scope. You don't have to worry about any downfalls that come with it. It's all happy and bright, I would say. Just have a positive mindset. Whenever you pick a branch, be positive about it, and everything will turn out fine.
Yeah. Yeah, ma'am. And same thing with radiology. There is never an unemployed radiologist. You have huge number of, job opportunities. Immediately your post MD also. And if you are looking at, learning more interventions, there is much more scope there. And interventional radiology is taking up big time, and there is a lot of telereporting happening in radiology. So you have a very bright future. I mean, there are a lot of subspecializations coming up. Even in radiology, you can do neuroradiology, musculoskeletal radiology. So there is a lot of technological advancements happening. Lot of AI coming into it, which is assisting and which is making the images, identification, the pattern identification much easier and assisting the radiologist better. So a lot of scope is there, especially in radiology, and it has been the center stage for all the hospitals now. It has, taken up a very, very pivotal role. So going forward, it is only going to amplify with the technology becoming easily available and more, advanced. So definitely you should look into those aspects also. Ma'am, what are the specialization options available, ma'am? You said about aesthetic part. Any other things that you
Yes.
want to
Sir,
recommend?
there are specializations available. Like you can be an occupational dermatologist in areas which are industry heavy, which are occupationally heavy. You can be an occupational dermatologist dealing with those disorders. Then pediatric dermatology is a very important component. There are specialized fellowships, there are special courses after PG which are available. So pediatric dermatology is a very niche branch. You get a very high quality clientele if you want to specialize into it. Then there is geriatric dermatology, there is aesthetic dermatology. You can be a transplant surgeon where you do hair transplants. So there are multiple sub specializations that are available which you can do as per your choice. I would again say you don't have to give any entrance exam. You don't have to sit for another 3 years of a super specialization. And yet you can choose one of these. You can choose a fellowship as per your convenience and choice and become a subspecialist even in this branch.
Yeah. Same thing in radiology. You'll have a lot of specializations. As I said, neuroradiology, musculoskeletal radiology. You have interventional radiology, and fellowships are available easily. I mean, if you want to pursue them, different specializations and fellowships are available. And usually, this are end branches, right? Radiology and dermatology usually are end branches. But if you want to enhance your skills, there's definitely an option available. And the more obviously the fellowships that you do, the more chances you would improve also. Ma'am, an important aspect everybody would be looking into is what are the job opportunities in the hospital
Job.
setup, own clinics.
So as we finish PG and senior residency, we first have to identify with ourselves whether we want a research-based academic job or we want a non-research specialist job. These are both institutional jobs which you get in government setups, you get in medical colleges. So this is one category where you can go to, and the second category is your own private practice. Now, if you are somebody with a research bent of mind, you want to be involved in academics, I would say the chances of getting that as you get out of PG are on the lower side, because I've said it that dermatology departments are smaller. People tend to join, they don't leave their jobs that easily. So the vacancies are far and few in number, as compared to the core clinical branches where they move out for their super specialization, they may move out to other setups. That does not happen so much in dermatology. So institutional jobs are few. So with those who have an academic job in mind, it is not very easy. But yes, opportunities do come out. You can always take them with so many private colleges coming up. Even in dermatology, the faculty jobs are much easier to get now because of the private medical colleges. Now, coming to the jobs in MNCs, I've already told you there are no fixed full-time jobs there. So that is a very big con that you have to think. You suddenly want to get out and earn 2-3 lakh a month. You don't get that in derma. You would see all your colleagues doing it. That does not happen here. You have to work in an aesthetic clinic like Kaya, VLCC, something, or maybe with a senior dermat. So that is a very big lowdown as you come out of PG. You feel on the top of the world that you've finished derma, and yet you are on the street not knowing what to do. And then you have to find a space, open a clinic, go through the initial years of struggle of a clinic as it builds up. So that could be a little bit of an issue. But if you have that clear vision in mind that yes, your clinic will run. When I started my clinic, I used to feel, oh, there's just one patient today. Oh, there are just 3 patients today. I used to feel very disappointed, very low on confidence. But when I went to meet my seniors in conferences, they all used to say, Sab ho jayega. It will all work out. Don't worry. This is just the initial year. And thankfully, I can tell all of them that, yes, you were right. So this would happen with you also, but it doesn't matter. It all works out. It will work out wherever you work hard. That is what I would say. It's just your hard work which takes you places.
True, ma'am. True, ma'am. And as far as radiology job opportunities are concerned, they're abundant, guys. Whether it is the main cities, whether you're in your metro cities, your capital cities of your states, or even your tier 2, tier 3 cities, there are abundant job opportunities for radiologists. There is lot of hospitals require them. We work on shifts, right? There are radiologists that are given slots that they can come and report, and there are diagnostic centers, but not just attached to the hospitals. You can also go and there are a lot of diagnostic centers coming up, and you could also set up your own place also. So you can start with having a ultrasound machine and doing a lot of scans, ultrasounds, and then build up from there. So basically, job opportunities are present abundantly in all the cities. There is not a saturation that is there, and if you want to work remotely, teleradiology is coming up. And if you are a procedure-based person, obviously the earning would be better, and you should look into interventional radiology if you want to have the clinical feel or clinical touch also, and also have a better earning opportunities. Interventional radiology is the thing that is coming up for you. So a lot of abundant job opportunities, and especially if you go into your tier 2 cities and stuff, radiology has much more scope there. There is much more demand and much more opportunities there that you can explore into. And ma'am, what are the abroad options available for students after pursuing this MD?
See, in all clinical branches, when we talk about options abroad, it is US, UK, or maybe the Middle East that we broadly talk about. I would say your Indian degree gives you the chance only to work in the Middle East when it comes to dermatology. So there are plenty of jobs there also which give you very good tax-free income. So that option is very lucrative when you become a dermatologist. You have that in mind that you want to move to the Gulf, you want to move to one of those countries. Dermatology, I would say, is an excellent option because again, you get all the perks of being the doctor there, yet you have an easy life without having to deal with nights and other issues in a foreign country. So that is there. But when it comes to UK, you still have to clear your CLAB exam or your MRCP exam, whichever you give. You have to get a GMC registration. then you can get a specialist job. You don't need to enter their training again. So the important part is that you don't have to get trained as a dermatologist in the UK. You just have to get a GMC registration, whichever path you follow, and you can start working as a specialist, that is ST category, there as you enter into their hospitals. So that is a good option if it comes to UK. US, you have to pursue the whole USMLE route. You have to do their residency, and then you pursue a fellowship, which gives you dermatology as an option. That I would say is not there. You cannot, hardly one or two people over the last many years have got to go and practice dermatology in US. That is limited. So if US is on your mind, dermatology is not an option for you. In that case, the medical branches other than derma are better off. So US is not there, but UK you can easily move. Dubai, UAE, Saudi, all these countries you can easily move.
Yeah.
Australia, you can give the step 1, but you have to give step 2 to work as a specialist there. That waiting period is very long. So that is also a little, long drawn out path if you want to go there. So that's all that we have in terms of opportunities abroad in derma.
I think for radiology, US is a more achievable target. If you are writing your step 1s and step 2 and you're getting your ECFMG certification done, you can actually pursue residency in radiology or can also opt for fellowships in radiology. And you can be eligible with your MD degree of radiology. After clearing your steps, you can go and follow, pursue your fellowship in different specialties in radiology. And that would widen your scope of getting good job opportunities also. As far as UK is concerned, as ma'am was telling, US, UK, and Middle East, these are the 3 things that we look at when we talk about abroad options. For UK, you can be FRCR certified. You can write an exam and clear for FRCR, and that will also give you a bigger advantage to practice and to work in different countries. Middle East, yes, there are decent opportunities there also. But if you can have any of these FRCR or fellowship from US, you will have much better pay scale when you move to Middle East with FRCR or your US fellowships. So look into those things, and there is abundant opportunities for that. So radiology is like a very in demand branch for these things. And there are some students asking a few things, ma'am. Shravanti is asking for more academic or teaching involvement, which balances both clinical practice and education. Which branch would be better, radiology or dermatology? What would your call be on that,
See,
ma'am?
if you talk about clinical practice, yes, in radiology also those options are there. When you take interventional radiology and all others, you can build your own practice. But if you just talk about these two things in the same sentence, I would say dermatology would give you that advantage, because dermatologists are academically very bent. You will always see a dermatologist taking out a book, reading about DDs, because we have to make a diagnosis instantly. We don't have any blood test, X-rays or CTs to help us make a diagnosis. So we start reading right in front of the patient. That happens so many times. So if you are somebody who's academically oriented, dermatology is a good branch. We have ample of conferences where there is so much academic discussion. You can keep sending your papers and your studies. There is ample opportunity to do academic practice and education in dermatology. Clinical practice, it gives you all the advantages of being a clinician, minus the stress of handling patients, minus the stress of patients having mortality or giving bad news to the relatives, handling the relatives' violence. So all those things you don't have to face in dermatology, and yet you tend to be a clinician helping patients, make their life better. So you get a mix of both of them in dermatology. What about the same thing for radio, sir?
I think, ma'am, Shravanti should look into getting into medical colleges, which have good radiology and centers. They will have lot of learning opportunities and also a lot of teaching opportunities also. So there will be a lot of academic activities with your postgraduates. You can have a lot of undergraduates coming in to your department if your inclination is towards the academic part. And yes, being in a good government medical college setup, this will give you a lot of clinical exposure also, like a lot of cases happening, a lot of MRI, CT scans you're reporting on a daily basis, and also a lot of academic balance that can have. So I think medical colleges are also rampantly increasing in the country, and there would be opportunities in that segment if you're wanting to balance both teaching as well as your clinical practice. And Dharmik is asking, haven't read much radiology. Is it too much anatomy? I'm very scared about it. Dharmik, initial part would be like that. I mean, obviously, we are going to look at images. We are looking at cross sections, right from the, all the parts of the body, the brain, the limbs, and everything. So, initial part of your training, the first year of radiology will have, your radiological anatomy as your primary subject. You will be just trying to understand. This is like a course, okay? The whole year you are only looking at sections, cut sections, and you'll be day in and day out seeing the same images and every day. So it is going to get easier. So need not to worry about the anatomy part. This is something that you and need not be very very carried away from the branch, because you have to know anatomy. Anatomy is needed for every branch, whether you want to do a surgery, whether you want to do orthopedics, whether you want to do radiology. You would know that. You will just look at those cut sections, and because you're seeing more frequently, it should become easier. Initially it looks like that, but it should become easier, and nothing to get scared about. And Jay Mohan will take your query on DMRD in some time. And Shruti is asking, ma'am, is it worth spending 80 lakhs in private college for Dhamma? Your call on that, ma'am.
See, it's not about spending 80 lakh or not. First of all, you have to assess your liking for a branch. If you like a particular branch, you're getting it in a good government medical college, take it. But if you like that branch so much, you're not getting it in a government setup, you have to go to a private setup for it, you can take it. I would say it is more, the priority in this would be your liking for a branch. Second thing would be, how do you manage to pay that money, whether you have to take a loan or you have the resources to pay for it, howsoever, whether you sell something or you take from your parents or whatever. So if you have to take a loan and pay for it, if this was your first attempt in NEET PG, I would say maybe you can take a drop, give it a second chance, see if you can get a better score the next year. But if this is already your second or your third attempt, I would say, if you're getting it, maybe see if you can afford it in a decent way, maybe take a student loan or something, because student loans have better interest options and better ability to pay it out as you come out of the education of your degree as compared to other types of loans. So it, I think, depends upon your liking for the branch and how you can afford it. If it is about taking out the investment, earning the money that you have spent, I would say you do that in every branch. That is not your criteria for deciding it. You can take any branch and you can earn as much as you want from it. It just depends on your aptitude and your ability to set up that kind of a clinical practice. So I would these are my criteria. Sir, what would you suggest if such a question would come?
Yeah, I would say, it has to be a decision, made in the family about how important, they would want to invest into, to get into a branch. So if the money is too much to afford for the family, I think they should think on that. But if they are able to, get it, they couldn't spend it and they can afford it, and they like the branch so much, why not? I mean, if you're really passionate about it and you are able to afford it, there should not be any hesitation to take a branch of your choice. But if it is a significant money that would hamper decisions for your family and all, I think you should actually think these are not the branches that you just spend money and expect to start earning immediately after things. Okay, so it has to be a calculated decision, a financial decision discussed among the family, and going ahead for that. And Life is asking whether government jobs are saturated in radiology. No, there are a lot of medical colleges coming in throughout the country. There is huge opportunity. There are a lot of vacancies available every medical college for radiology. So I don't think there is a saturation right now. You will have a lot of colleges also upcoming, right? We had the Prime Minister also announcing some 75,000 seats, medical seats increasing, and it will be a huge opportunity. Right now, the medical colleges are in expansion mode, and you can look for a lot of jobs, even in your medical colleges, if you're looking into. Then, will AI affect jobs in radiology? Now, this is something very frequently asked. It has not affected so far. I see so many topics on AI, but this is just image pattern recognition. It only eases the life of a radiologist. It helps assist the radiologist. It finds the defects and shows it to the radiologist to interpret. So the pattern, it will rule out normal X-rays from the films, and it helps assist the radiologist, but does not replace the radiologist. I feel AI will only improve the life of radiologists, make the life of radiologists easier, rather than to be scared about AI. And scope of entrepreneurship in radiology, does it have high return on investment? Pradeep is asking an important question. Yes, if you are, first thing I would say is don't go heavily at once. Start slow. First, get your skills right. Learn all your skills properly when you are in your medical school, right? Throughout your residency, learn how to do your ultrasounds well, how to, do your procedures, color Doppler, do your CT scan reporting well, MR reporting well. See that you are the finest person, while you're reporting these things. And then start slowly. Start with an ultrasound or a X-ray unit, and then get into slowly, building that scope of patients with your ultrasound. Ultrasound is the bread and butter in radiology. So if you are successfully running your ultrasound center, that itself is a huge benefit that you will have. High returns on investment would be there when you have a successful ultrasound center. And then, yes, you want to take a risk. You can go for establishing your CT scans and MRI, but you should have a very good contact circle in your place that you are practicing. So by starting with ultrasound, you know how your referral units are, how your contacts are in the area that you're working in, and then you can start thinking of getting. Don't go heavily at once. I would say take a stepwise approach. Build your connections well, build your relationship with your physicians, your surgeons well, and then based upon you will know that yes, if I get started with CT, I'll have so many of my patients coming into it. You can make a decision accordingly. And yes, that definitely works well, especially post COVID. We had a lot of CT scans done and stuff. So many of the diagnostic centers which opened at that time, or which had some loans also, all of that got cleared. So it definitely works. But be careful also where you're opening it. So don't open in a very already saturated place where a lot of centers are there. So you'll have to be selective whether you would want to open up your setup, which place you want to open up, how you want to open up. So you should have a lot of groundwork done before you launch yourself completely into it. And telereporting effect radiology, it is going to enhance radiology. It will give you assistance to radiology, Niranjan. It will not be it is a added benefit. You can plan to do little more reporting if you want back from the hospital, back from your diagnostic center, from your home. You want to do thing. You don't want to add on to that rather than affecting it. I think other questions that we are getting here is DNB in private institution, MD, DNB, diplomas. Ma'am, your take on this?
Sir, I would say the branch is paramount. First of all, decide whether you wish to pursue this particular subject or not. Then you assess what you are getting at your rank. If you're getting MD, you're getting MD in a good medical college, good. But if you're getting MD in a relatively newer college or a very far off remote place or a new private medical college where you may not have a lot of patients, then I would say instead of pursuing MD in such kind of a setup where you wouldn't get a lot of exposure, you wouldn't get to see a lot of patients or academics, then see where you are getting DNB. If you're getting DNB in a good college with good exposure, with good teaching, that would be a better choice as compared to MD in a remote college. MD and DNB are more or less equivalent if you talk about job opportunities in private setup. They are not going to differentiate, based upon whether you are MD or you are DNB. In a private setup, even in government jobs, they are almost equivalent. You have to pursue a senior residency, you become equal in both these branches. So MD and DNB, the choice would be where you are getting your subject, where you get an exposure. The only disadvantage in DNB is you have to clear 2 exams. So these are, the theory exam is equivalent to what you get in MD, but since teaching is on the lesser side in DNB hospitals, since they are more of private hospitals doing DNB, so teaching is not so much, it's a little difficult to clear your practical exam in DNB. That is a disadvantage. Other than that, nothing except this for dermatology, I would say, when it comes to choosing between MD and DNB. Diploma would not be obviously the first choice. It would be if it is your second attempt or your third attempt. You don't want to give another attempt. you just want to pick up a branch of your choice. If you're getting it in the form of DVL, that's Diploma in Dermatology, Venereology and Leprology, DDVL. So if you are very passionate about this branch, you are getting it, you don't want to give another attempt, then I would say you can pick up diploma also. In private setup, again, in tier 1, in metro cities, there may be some differentiation, but as you go to tier 2, tier 3, if you're a good dermatologist, nobody is going to see whether you are an MD, DNB or DDVL. It's all the same in your private setup, especially in tier 2, tier 3 cities. In metros, it may be of slight disadvantage, but if you know your subject, again, you'll shine through. Another option after diploma is to do a secondary DNB. So that is always there. If you're not happy with just being a diploma, the option to do a secondary DNB is there. So first priority is which branch you like. If you're getting it, you take it. Depends upon your attempt at NEET PG and whether you are ready to give more attempts or not. And third is what is your future plan. If you already know that you have to do a private practice, then whichever of these three you get, you can just jump upon the opportunity and take it. But if you intend to do an academic job, a government job, then the diploma would not give you that option. So, you have to actually have a clear vision of what you want in your future before you make that choice.
Yeah, ma'am. Have some advantage. There is high pass percentage in MD. A good government college MD of radiology you're getting, which has all the setups, right? MRI, CT, and all the modalities for you. Choose that as a first priority. When you're going for private MD or a DNB, this is where you have to think if DNB and MD have equal job opportunities in radiology. There is nothing much of a bias once you have a good training in all the modalities, a good MRI, CT scan machine learning you have learned. Opportunities would be there whether you are doing from a private MD or a good DNB hospital. So I would hospital for DNB, even DNB is a better option than spending too much and going into a private MD. So keep that keep that thought process in mind. But which kind of DNB are you getting into? What are the number of seats that you have? What is the patient load that they have? If you have, that would be there. If you're really passionate about radiology, you don't want to do anything else. You can be a startup. You can do diploma, DMRD, secondary DNBs. So, but try to see that you end up doing secondary DNB when you are going for DMRD. So, MD from government colleges, that should be your priority. All the modalities available. Second, between private MD and DNB, choose a good college which academic training has a patient load happen. Hospital would be preferable over private MD which is not having proper modalities. Then coming to diploma, if you're very passionate about the branch, to go ahead and more and get your secondary DNB, I would say you can look into diploma. If you are getting some higher rank and you are really passionate, you can look into that. At the end of the day, once you have done your DNB requirement, there is huge vacancies even now for radiology in the country. So do not be afraid about that, and you can happily take that up. I think, ma'am, we have covered most of the points. And what are the salaries that they can expect or post? Any quick words on that, ma'am?
So salaries, if you get with an aesthetic clinic or a hair transplant clinic or a senior dermatology, salaries can range anywhere from 1 lakh to 2.5 lakh a month, depending upon the number of hours you put in. The thing is that your weekends are working whenever you are working with any such setup. So Saturday, Sunday is working. You take up dermatology thinking you are going to get weekends off. But in most of the private setups in derma, after PG, the party is over. You have to work on the weekends. So salary is between 1.5 lakh to 2.5 lakh a month in these setups. These are the only places that give you a fixed pay. You don't get fixed pay in other private corporate hospitals. You don't get that.
And I think even in radiology, these branches have to be higher compared to your other clinical branch. Feel that once you are soon out of MD, your payments in your radiology and are definitely on the higher end compared to your other clinical. But your clinical colleagues will make the curve of earning will be more for them later on, but you will be earning and plateauing off after a certain time. So the amount that you should be looking at soon after MD is around 1.5 to 2 lakhs, and going close to 4 to 5 after a few years that you have invested into your radiology practice. So this is what you can and obviously when you have your own setups and stuff and you have good entrepreneurial skills, you definitely make much more than that. And what are the things to look for when you're choosing DNB? As I told you, look at what kind of MRI machines they have, 3 Tesla, 1.5 Tesla, what kind of CT scan, and what kind of academic programs they have, what is the pass percentage of the DNB residents there, and how is the academic training happening. So all of these things, what is a pass percentage of the previous batches there. So these few things you can identify and make a selection on that. Now the pass percentages are higher and there is no much problem whether you're a MD or DNB. Just look that you are getting exposure to most of the modalities, and a lot of self-learning also happens in radiology. There are a lot of resources available. IRIA is a very strong association in radiology, right? And they have a lot of state-wise, zonal-wise activities happening, and there are a lot of self-learning that can happen. So choose wisely and not be too afraid of picking up a DNB radiology. Okay, it will be a good decision also. And what will be good? Should government jobs after DNB or MD? Ma'am, anything on that?
There is, as per all the government medical colleges, there is no differentiation made between an MD and a DNB when it comes to the job of a senior resident. When it comes to a faculty position, they just see what your research papers are and what your academic bent of mind is. So if you have that, you should not worry about MD versus DNB because the opportunities are equivalent, but not after diploma. It is not the same after DDBL.
I think we have taken up most of their queries, ma'am, and I think we have given a wholesome perspective about the branches. Whichever branch you choose wisely. This is a lifetime decision, and be passionate about your branch. Be the best version of yourself. Give your 100%, and whatever branch you choose, and if you give your 100%, you will be that decision will be the best decision for you, and that branch will be the best branch for you. And thank you so much for joining us tonight for this interaction, and I hope you got some useful insights from both of us. Ma'am, I think we have covered pretty much a lot.
Yes, sir. Yes, sir. And I would also sum up by saying that you should not be choosing a branch depending on what you hear from your friends, what you hear from any of us. The branch that you choose has to be of your own liking, your interest, and your inclination, because you are the one who has to study it and pursue a career in it. Okay, it's not like a job which you can change later, thinking, oh, I don't like this, I can change it. That is very limited. So make an informed choice. Make a good choice, be comfortable and satisfied with your choice. When you make a choice, you take an option, it is because you leave the others behind. So if you have a short list of the branches that you want, take an informed decision. But if you're passionate about a branch, choose passion and be happy with your branch. That is all I would say. Just have to do it well. You have to be shining at the end of it. Give it your 100%, give it your best.
One question, ma'am, Niveda is asking. I'm sorry to take, but I feel this was interesting. What are the things that we need to look at before we take the MD in dermatology in a college? So, what are the things, perspectives to look into before they choose MD in dermatology in a college?
See, since dermatology is a medical branch, you have to have a high volume exposure to patients when you take a college. When you choose a college, see what are their OPD numbers, what is the kind of walk-in into the dermatology OPD, because as many patients as you see, you get better. Again, I would say it's a visual branch. So the more practice that you get, the better you be. Second thing is you see the quality of the investigations that are available, the other branches also in that hospital, because you also want to see referrals, you also want to see dermatological manifestations of other internal disorders. So overall, it has to be a hospital with high volume. You don't need to look at any as such machines or the infrastructure that the hospital provides, because we don't need so much in dermatology. We need a basic lab and a basic OT, which is there in all the colleges as it is mandated by NMC. So in terms of infrastructure, you don't need much in a hospital. You just need to see whether they have a high volume branch, whether they have adequate faculty on bench, which are available for teaching, and whether I don't think there is any other criteria. The better hospitals, like in Delhi, our hospitals, they have phototherapy machines, they have all types of lasers available. So that is if you're getting it, good enough. If you're not getting lasers, it doesn't matter. You will learn it all after the job, but that should not be your criteria. If you're getting it, good. Even if you're not getting, it doesn't matter. So that is the only thing that, maybe a little extra in good government medical colleges. That will be something you get extra if you're doing DNB from a reputed private setup also, because they do have access to all these machines. So that's all that you need to see. Basic and the most important criteria is the OPD walk-in of that setup, because that is going to teach you the branch.
And thank you so much, ma'am, for the wonderful insights. I'm sure it should benefit a lot of people who want to choose dermatology. And I think there are abroad opportunities and other things, salaries and all. We have discussed that. And thank you so much for joining, ma'am. And I wish all the students listening to us to make an informed and wise decision and be happy with your decision. And best wishes for your future. Wish you all a great and a bright future ahead.
Yes. Thank you, everyone. Good night.
Good
Wishing
night.
you all the best.